From Washington, D.C. to the Central Coast, this is Focus with Farr, where our representative in Washington hosts in-depth discussions of important issues of the day. And now, Congressman Sam Farr.
Hello, and welcome to another episode of Focus with Farr. During the past few weeks, there's been a lot of talk coming out of Washington about cutting budgets to reduce the size of our deficit. Now, while I agree we need to find ways to reduce our spending, we need to make sure that those cuts reflect our priorities. Only by understanding there are real people behind those dollars, there are real people behind the cuts, and Congress can ensure that we can truly serve the needs of communities that elected us. To help us understand how the choices made here in Washington have an impact on the lives of Californians back home, I've invited Linda Williams, the CEO of Planned Parenthood Monte, which is the region and we're in. I want to welcome you, Linda, to Focus with Farr. And I know as CEO of Planned Parenthood Monte, you have overseen an operation of about, I think, 32 health center locations in 12 community sites. You provide vital health care services to 42 counties throughout Northern California and Nevada through medical services, education programs, advocacy initiatives. Planned Parenthood Monte serves the needs of over 250,000 men, women, and children. So welcome, and I'd like you to could tell us a little bit more about your mission. As you know, I was a Peace Corps volunteer in Latin America. I came back to the United States. I was in a barrio in Colombia, South America. The average woman there had 17 children documented.
Wow.
And in fact, in one of the medical documents, a woman in that area had 32 children. Now, they had no access to information or to prevention. They couldn't read and write. There was no electricity in the houses. It was, and a lot of those babies died. I mean, it was a real tragic situation to see, just population without information. And so I came home, and my wife Sherry got very involved in working with Planned Parenthood in Sacramento in the late 60s and early 70s, and came home and talked to me about all the cases, the stories of young teens who were just telling these tragic cases and stories about their lives, having gotten unintentionally pregnant and then not knowing, about pregnancy or about choices or everything. And I think Planned Parenthood has provided an incredible resource to our communities. And some people think you're just a federal agency or a state agency, but you're a private nonprofit. You raise money on the private sector from foundations and individuals who grant, and you also receive contracts from the federal government, state and local governments. And you have a huge responsibility for this region of Nevada and Northern California. Tell me a little bit about how you see Planned Parenthood providing this vital role to our community, and if funds are cut, what might happen?
Well, thank you so much, Sam, for the opportunity to be here today. And as you say, federal funds are not the whole of our resources, but they're an important component of our resources. And one of the things we're very proud of is what value we're able to give taxpayers at the federal, state, and local level for the funds that flow to us to help the people we serve. And for every dollar invested in family planning in California, the state saves $10 in the next 2 years. It's one of the best bargains in government funding that those dollars can buy, because our services are preventive, and largely it's preventing pregnancy, preventing the consequences of disease by testing early for cancer screening and for various sexually transmitted diseases. We check thousands and thousands of women for breast and cervical cancer and hopefully help them catch early. We have many services, both educational and more intensive for teens. You mentioned teens who are pregnant and have heartrending stories. We have 24 teen success groups of 12 teen moms each, and we help those teen moms graduate from high school and go on to develop goals and plans for an independent future for themselves and their babies and toddlers and growing up. And some of those young women who have been homeless, who have come from abusive families, who have been involved with substance abuse, and the strides they make and the contributions that they end up making first to themselves, then to the education of their children, and then to the communities around them is really quite inspiring.
Well, I think what's also absolutely essential, if you're going to have access to the future, sort of a quality of life, you've got to have access to education. And sex education is, you make it accessible, which is, I think is so important. People don't realize that. It's, people say, well, it's out there and you can get it, but you're going to have a place to go and talk to doctors, to nurses, to people who are really informed, because everybody has a different story. It's a different case with each people. And what I find is the clinics that you operate, and I understand there are a lot of men that visit these clinics as well, because one, they're accessible. You can walk in and get exams, and I think there's not enough of this in our society where people have access, because of, usually it's access is one geographical, it's too far to go, or access is also, well, it's there, but I can't afford it. I give the analogy that we have to my high school friends is that if you're going on to college, Stanford isn't so far a drive from the Central Coast, but so it may be geographically accessible, but financially it may not be unless you get a lot of help. And one of the things that your clinics do is also help without.
Absolutely. We welcome anyone into our health centers, and we do, and we also, sometimes people can't, as you say, can't come to our health center. So that's why we both have the community sites and we do education in the community. We take our sexuality education on the road, and we take it to high schools, and we take age-appropriate education to middle schools. We educate parents to become better sex educators of their children, because we firmly believe that parents can really do the best job of transmitting their values as well as the information around responsible sexuality. But many parents need some assistance in feeling comfortable having the talk.
Well, we're talking about accessibility to clinics, and the fact that with drop-in anybody can drop in, and even men can drop in and get access to medical information and to medical exams and things like that. Talk a little bit about why Planned Parenthood and the Marmonte. You have a lot of clinics in our area.
We do.
Who comes in?
Our patients on the Central Coast, the youngest are newborns. They are the children of our prenatal patients that moms then bring in for pediatric care, because not everyone knows that we provide general health care in addition to contraception and breast exams and cancer screenings and STD tests, and we provide that general health care for people from birth through as long as they come to us. The oldest patient in the Central Coast that I'm aware of started at our Watsonville Health Center when he was 93. And he called one day on January 2nd, I remember, because managed care was new then. And he had been auto-assigned by Santa Cruz County to our Watsonville Health Center for his primary care. And he obviously had a sense of humor as he called, and he was the first call that they got on January 2nd when they opened, and he said, "I'm calling to wish you a happy new year because the county thinks I need Planned Parenthood for my health care. I'm expecting it to be a really good year." And he remained our patient for 3 years until his health care became more complex and he needed someone who was specialized in geriatric medicine. So we serve everybody who comes to us of all ages, and as we prepare for healthcare reform, we are really focusing on making sure that our capacity is great enough in those health centers to be able to welcome the newly insured people.
Sure.
As
Everybody
well.
will, under the new health care plan beginning next year in 2014, every person will have a health care plan and have an insurance, and they'll be covered. And some of that insurance will be subsidized totally by government, and some of it will be partial pay, and some will be full pay. It'll depend on one's income and choices. I mean, I think about 75% of the people who are now insured don't have any change in their insurance, really. It's the ones who are not insured or who can't afford insurance that will be covered. And
I do want to stress we will also welcome the people who, because of their immigration status, might not be. We'll welcome those into our health center.
Well, I always say, you know, this whole issue, you can't really differentiate and say people who are non-documented can't have health care. My God, they break bones. Their kids get sick. They go to school, and
they need contraception.
You want to be healthy. I mean, I think the wonderful thing about access to proper health care is it is, as you stated in the opening, it's an ounce of prevention. Our society and our culture is very much interested in spending the money up front to educate people so that they can make the right choices and not have an unintended and expensive outcome for their own lives or for the lives of unwanted children. I don't think we can talk about Planned Parenthood in a political agenda like this in our nation's capital without talking about abortions, because that's the big controversy here. And I like to remind people that there isn't a penny of federal money or state, I don't know about state, but not a penny of federal money that goes to paying for abortions. Now, Planned Parenthood provides those services part of a medical clinic, but it's not just abortion on demand. You come in and you can explain it better. And women have, as you said, when they get pregnant, there's a lot of decisions that have to be made. Well,
contraception isn't accessible to everyone, and use with the best will in the world isn't perfect. There are contraceptive failures, and women do face unintended pregnancies. And when a woman faces an unintended pregnancy, she has some really difficult choices to make. And some women are fortunate enough to have many people around them in their lives who can be sounding boards as they process the choices that they have to continue the pregnancy and raise a child, to continue the pregnancy and go through adoption, or not to continue the pregnancy. But some women don't have anyone in their lives to talk with, and we're there for them to come in and have a thorough conversation about their options.
And that thorough conversation, which I think people don't really understand, is all the options.
Yes, absolutely, it's all the options.
Exploring all of these things and what your alternatives are.
And I think that some people may imagine that every woman who comes into Planned Parenthood to talk about an abortion ends up with an abortion. That is absolutely not true. Sometimes women think that that is what they want, and then after talking it through, they realize that another option will work better for them. Sometimes it's exactly what they want. Women need the ability to make the decisions about their lives for themselves, and although abortion is 3% of our services, it's a service that we will make a commitment to provide as long as contraception is imperfect, and women need that service, and women and families. It's often about the whole family.
Well, it seems to me that's so fundamental to our believing that we empower people with information to make sensible decisions. And this is where I think, government, as we've stated, doesn't put a dime into abortions, but we still encourage the counseling and the information, the educational process that people ought to have. And I think that's so essential to a quality of life experience for newborns and for the parents and for handling. So that's why I've been very supportive of Planned Parenthood and the organization. You have clinics throughout our area. I think I actually have some figures here of the number of clinics and the number of people you've provided services to. But as I see, you have clinics in Greenfield and Salinas and San Benito County and Watsonville and Seaside and Santa Cruz. And as in our area, about 60% of the money comes from state family planning program.
Which does have a federal funding stream contributing to it. It's not all federal funding, but it is partly federal funding.
And about 90% Medi-Cal. And then you have private insurance people who come in with their own insurance, and that covers their costs, or self-pay.
And we have self-pay.
And
we have very generous individual and foundation contributors as well for many of our education programs and for subsidized services in healthcare as well if people can't pay.
And here about 20% are people 19 years and younger. So I presume most of those are women. You don't have many teenage boys coming to the...
Actually, we do. And remember, some of those are pediatric patients as well, because we see babies and toddlers and young children. So 19 and under it certainly is teens coming in for contraception and STD testing, teens of both genders. Overall, about 11% of our patients are men.
That much?
Mm-hmm.
That's because of the accessibility of your clinic and the specialty that you give in that. You couldn't really, it's much more difficult to get those services.
And because we have a reputation for being extremely confidential in our care. That's another reason that people sometimes come to us with sensitive issues.
Mm-hmm. Well, how do you've been CEO of a large area. You have to deal with a lot of politics. Do you find it's changing? Is there more of as society becomes more informed? It seems to me we're the better educated we get about sort of the culture of poverty amongst us, people who don't know how to read and write. And there's a lot. People don't understand that when you can't read and write, you don't get information on your own. It's storytelling or watching television. And if you don't have access to health care when you're sick or have a broken bone or injury or you have a congenital disease that you've got to have it treated. And if you don't have access, you can't have it treated. It seems to me society is beginning to be much more aware and concerned that all people need to have sort of this access, one, to education and access to health care. And third, I think everybody has to start with a safe place to sleep and food, obviously.
Absolutely. It's hard to be healthy if you don't have enough to eat.
And so the question is, if funding wasn't for Planned Parenthood and we didn't have these clinics, we would just be denying people, as you said, of all ages, incredibly easy, affordable access to health care. And do you find that there's more support, or is the politics? I mean, you've got a lot in Congress. It's debated all the time, and unfortunately, we keep I think we keep the majority strongly run by women in Congress, and keeps the funding going. And with the new president's health care, we're going to segue into a lot more accessible health care. And don't you think your clinics are going to be playing even a more important role?
Absolutely. One of the things that I am particularly excited about in terms of healthcare reform and access is a group of women that faced a gap essentially between menopause and Medicare, because in California, access to health care is pretty good over the span of a woman's fertility. But when then the family planning services are no longer available to her, and there's this funding gap. Mm-hmm. And that's the age when a lot of chronic diseases begin, the hypertension and the diabetes, and maybe
sort of that 10-year gap between 55 and 65.
Or 50 and 65 when there's no coverage.
Yeah, and many people they're retiring early, or
they had a job that didn't provide health care. And so what we see are women coming in, and we can provide them with the primary care, but if they need specialty care, it's hard to find a place for them to go. And with health care reform, that gap will be covered. And another characteristic of women is that they concentrate on their children. They may be dealing with both aging parents and children at the same time in that age group, and they put themselves last in terms of their health care. And so sometimes it's heartbreaking to see diseases more advanced because they didn't have a cancer screening, or they didn't have that preventive care, and now they're going to be able to get it. So the funding that will allow that to happen is just critical to our nation's health, particularly as we know we're facing more seniors with the boomers, and so they'll enter Medicare healthier because they'll have had health care all along. So and it's certainly true for men as well. And we do serve men, but sometimes the diseases women develop at that point, breast cancer and other reproductive cancers, have serious consequences. So this is extremely exciting that soon that gap will be closed.
And I think the message here is, look, these Planned Parenthood clinics and health centers are for everyone.
Absolutely, for everyone.
And it's not just for teens and young pregnancy issues. It's for the whole spectrum of medical care. It can be a referral center for women, for example, to diagnose the early diagnosis, can refer you to specialists and things like that. And it's also accessible for men.
It's care for the family over the life spectrum of healthcare needs.
What do you think is the pressing issues? Is always funding? Is it?
It's always funding.
Cut, squeeze, and trim. And that's part of why I want to do this program today, was to point out that as we cut funds here at the federal level, there's a trickle-down effect to our communities.
It's real people's real lives, and if people don't get preventive care early, they need much more extensive intervention later, and they will end up in the emergency room or in counties that have it at the county hospital, and that is more expensive care that will fall on the hands of government on the back end. So it's so much better to keep these preventive dollars flowing, and it's better for the individuals, and it's better for the community around them if all of us are as healthy as possible.
Well, I appreciate that. I mean, obviously, I am very concerned about limited public resources, public monies, taxes that people pay that they've spent well. An ounce of prevention is cheaper than the pound of cure. We know
Always.
that in everything. And this is just another delivery service of health care, general health care for our community, that is so important to have. And fortunately, we have Planned Parenthood, which raises money beyond just the governments. It's from private individuals and foundations. you're the CEO of a huge, I mean, you cover, what?
42 counties in
42
California,
counties.
mid-California and northern Nevada.
Do you ever not moving? Every time I see you, you're on an airplane.
Well, that's because, yes, we're off it. I actually am in my office 2 or 3 days at a time sometimes.
I appreciate all the work you've given, the enthusiasm you have, and the ability to really help our communities, to help our counties, our school districts and everything have access to affordable, quality health care. And I hope that Planned Parenthood continues to do the great job that it's been doing for our society in the years to come.
Well, thank you so much for your support, Sam. You're a bulwark for us, and we appreciate it a great deal.
Well, it comes from my family and training from my wife, and obviously this discussion I've had surrounded by women, young women all my life, and now a grandfather, and I'm very interested in making sure that our children and our grandchildren have access to affordable, quality health care, and that's why I'm wanted to have you on this program, Focus with FAR. I hope it's been informative for you in the Central Coast, and thank you very much, Linda Williams, the CEO of Planned Parenthood, our Monte division in Northern California and Nevada. Thank you for being here.
Thank you.
For more information, contact one of Congressman Farr's district offices. You can also reach Congressman Farr in Washington or visit his website.